In the last video, we discussed about what are the types of CMLs. Today, we'll try to discuss or touch base about what are the treatment modalities that we can have in the first phase. Whenever I diagnosed a CML chronic phase patient, I tell them that you have the best cancer in the world. Yes, it's right. You have a best cancer in the world because in the last 20 years, there have been significant progress in the treatment modalities in CML that you have targeted modalities or targeted oral drugs which you can take at home. You don't need recurrent visits to the hospital. And it is more like a disease like hypertension or diabetes. So, the way we detect diabetes at one point, you are having diabetes for the last few months to few years in your body. Similarly, you have CML for few months to few years in your body. The way you treat them with diabetic therapy, bring it under control and continue on the treatment for the whole life. Similarly, in CML, you can bring the disease under control with targeted drugs like imatinib, dasatinib or nilotinib as per the advice of your hematologist or oncologist. Continue the treatment. You follow the treatment stops. The way we monitor diabetes with HbA1c every 3 monthly, we monitor it with RK-PCR, that is quantification as to how much percentage of the disease has come down with the continuation of chemotherapy and whether it has achieved the required targets. The way we achieve HbA1c of less than 6 and say that it's good control, we have targets set at each quarter or each 3 months, 6 months intervals and then annually, and if we have achieved all the set targets, then you are monitored for every annual basis lifelong. Now these targets, as we say even in diabetes, it is achievable only if you have good strict adherence to tablets. So if you miss the medications, obviously your control of the disease is going to go haywire, your sugars are going to go up. Similarly, if you miss the chemotherapy tablets, your cancer cells are going to go up and it can also become tricky and develop resistance to the chemo agent and even for the next few agents to come by. So that is why it is always important that you have strict adherence to the tablet. You can lead a completely normal lifespan and you shouldn't skip the tablets. You just have to take 1 tablet for imatinib or 2 tablets morning evening for nilotinib or once a day tablet for dasatinib and follow the guidelines as per your hematologist and oncologist. Now, strict adherence is important to achieve these targets, and once you are through to it, you can lead a completely normal lifespan. So that is what the way I said before. This is one of the best cancers that you can ever have because you can lead a normal lifespan. Even if it is a blood cancer, you can still survive for the whole life. So you may not die out of the disease or of the blood cancer, but you may have age-related problems like heart issues or stroke and can have mortality related to that. Thank you.